Hello and welcome to our special show focusing on stroke awareness. We are broadcasting today in observance of World Stroke Day. Stroke has become an increasingly critical health issue in India, now ranking as the 4th leading cause of death and the 5th leading cause of disability. It impacts 1.8 million lives annually, emphasizing the urgent need for effective prevention and treatment strategies. Yet despite this alarming statistics, many remain unaware of the associated risks and consequences. In fact, 1 in 4 adults will face a stroke in their lifetime. Our initiative, Stroke Pe Rok, aims to educate, inform and empower individuals about stroke. Today, we'll dive deep into this critical topic, exploring the causes, symptoms, treatment options and the vital importance of timely intervention. World Stroke Day plays a vital role in combating stroke, a leading cause of disability and death globally. This campaign raises awareness and empowers communities to take proactive steps such as embracing healthier lifestyles and recognizing the symptoms of stroke. By doing so, we encourage everyone to seek immediate medical attention at the first sign of a stroke, significantly improving outcomes and saving lives. I am Amrita Varshini, your host for today's discussion. Joining me is our esteemed panelist, Dr. Saikanth Reddy, Interventional Neuroradiologist. And together, we'll arm you with the knowledge you need to make informed decisions and help reduce the burden of stroke on your healthcare systems. Let's get started. Doctor, namaste. Welcome.
Namaste.
Doctor, firstly, what is stroke?
Stroke or cerebrovascular accident is a focal neurological damage to the brain which occurs because of loss of blood supply to the brain or bleeding inside the brain. It is an acute condition. If we are not identifying it early or if we are not taking any necessary action early, it will result in a devastating condition and we have to act fast to treat the stroke. Since the stroke is a leading cause of death and disability in the world. So stroke is an acute emergency. Everyone has to identify the stroke early and we have to treat the stroke early. We call this as brain attack. Everyone knows heart attack, but this stroke we call this and we have to understand it is attack to the brain.
Okay, doctor, so to identify the stroke, people has to know the warning signs of stroke. So what are the warning signs, doctor?
So the stroke, as I have already told you, when there is a deficit or reduction in the blood flow to the brain, there will be a portion of the brain will get affected. So depending upon the portion which is involved, there are a lot of symptoms. May it be from the stage of weakness, slurring of speech or confusion. There are a lot of symptoms depending upon the portion of brain involved. So to make it more easier for the layman or the general public, we have found out an acronym called as BFAST.
BFAST.
So each letter in this BFAST signifies one symptom. So B stands for balance. If there is any loss of balance. If E stands for eye symptoms, that is if there is any blurring of vision or double vision, and F stands for when there is facial drooping. There is one portion of the face will lose the sensation or it will go down or up. F stands for facial drooping. A stands for arm weakness. Any part of your hands, hand or leg, if there is any weakness, you have to identify that is as a sign of a stroke. S stands for speech. When there is a slurring of speech, when there is speechlessness, so these are the warning signs and these are the symptoms of the stroke. And T is the most important thing. When you identify all these symptoms or signs in a patient, you have to remember that it is time to call an emergency service. You have to immediately call the ambulance and you have to ship the patient immediately to the hospital. You should not wait and you should not say that we will see and wait and watch and we should take to a local small nursing home. You take rest, everything will settle. So whenever a patient is having a stroke, you should remember the acronym called BFAST.
Okay. So, doctor, you said that when someone experiences stroke or someone has had stroke, it impacts brain. Part of it is damaged. And how does it exactly impact human body, doctor?
Yeah. So the brain is the master of the body. Okay. So for all parts of the body to work properly, brain has to work properly. When a blood supply to this brain gets cut off, so enough oxygen or enough nutrients will not go to the brain cells. So the portion of that area where the brain is not getting enough nutrients will get damaged. So once the damage happens, the brain, the controlling ability of the brain is lost, and the patients will have, the person who is having a stroke will have will not have the control on that particular organ. Say a person who is a proficient teacher or a news anchor who requires to speak properly, when that portion of the brain is getting affected, they can't speak properly. So it is a big burden. And if an athlete who is an active person, who his livelihood depends upon his athleticism, something happens to that portion of the brain, he can't run or he can't jump. All these happens when there is damage to the brain because of lack of blood supply, and then it will become a big burden not only to not only to him, to his people who is taking care of him. So that is the reason stroke is a global burden, not only to the person who is getting the stroke, to the family as well as the persons who are depending on him.
Yes, doctor. Doctor, now coming to types of stroke, does every people experience the same type, or are there any other types?
Yeah. So this stroke is it is an insult to the brain tissue. So there are two types of stroke. One is ischemic stroke. Ischemic stroke is one which happens when the blood supply to the brain is cut off. So it is like a field which is getting water supply. If four sides of a field is getting enough water supply from all the four sides, all portion of the field will be grown equally. When one portion is cut off, that area will get damaged. In the same way, enough blood should happen to the brain from all parts of the all parts of the brain. But when this blood supply is cut off, the portion of the brain which is not getting blood supply will get affected. So that is called as ischemic stroke. More than 80% of the strokes are because of this ischemia. When the same blood vessel increases in size, it becomes expands and it ruptures, or any breakage of this blood vessel happens, blood will come out of the blood vessel, and it will get stored inside the brain parenchyma. So it is called as hemorrhagic stroke. So these patients will present with severe headache and deficits. So that is a minimal portion, but that is also a very disabling stroke. So the 80% of strokes are ischemic stroke.
Okay. So doctor, in ischemic stroke, what are the risk factors associated with it, doctor?
So the risk factors, the major and the main risk factor for the ischemic stroke is hypertension. Most of our daily life, because of our stress, our way of life, that it is all surrounding, it is all involved in this disease. For the stroke, our day-to-day activities is of the most important thing. The major one is hypertension, which is of utmost importance, because this hypertension is controllable. Once we control the hypertension, the chances of we getting the stroke will significantly reduce. Other risk factors include our metro life, that is alcoholism, smoking, and obesity, hyperlipidemia, that is high cholesterol diet, overeating, less activity, less exercise. Each person per day, in every day at least half an hour you should spend for exercising. So the stroke itself is important, and why we are talking about this stroke today is it is preventable. There are a lot of things we can do to prevent stroke. If we exercise half an hour per day, the chances of stroke in a person will significantly come down. So stroke is a preventable cause, and we have to act accordingly to reduce the risk of stroke.
Yes, doctor.
Yeah.
Doctor, we have heard the term called golden hour.
Yes.
That is in terms of cardiac arrest or
Yes.
heart attack.
Yes.
But in terms of stroke, is there a golden hour, and is there a time where you can save the patient?
That's an excellent question. So, stroke, like heart, there is a golden hour. This golden hour extends from 4.5 to 6 hours. During this 4.5 hours to 6 hours, there is a scope. If you identify the patient with acute ischemic stroke, you have to immediately bring the patient to the hospital, where we will evaluate the patient and we will be giving either IV medicines or mechanical thrombectomy, depending upon the patient. This golden hour, everyone thinks that it is only up to 4.5 to 6 hours. But there are a lot of studies have been released. These studies says that this golden hour can be extended to 24 hours also. Okay. But you have to, there is a selective patients. It will work only in selective patients. Where you can extend this window to 24 hours, and we have to identify the patient as early as possible, and you have to bring the patient to the hospital. So following the proper guidelines and proper patient selection, we can extend this golden hour to 24 hours also.
Okay. So, doctor, when it comes to diagnostic measures, what are the diagnostic measures taken?
Yeah. So, when a patient comes, when a patient was identified to be having stroke, the symptoms of stroke, the patient was brought to the hospital, the patient has to be evaluated immediately, and you have to take him for neuroimaging. The neuroimaging includes CT angiogram, or MR angiogram. This CT and MR is necessary to identify whether there is a bleed is there or not there. If no bleed is there, we have to do an angiogram. This angiogram will allow us to know whether there is a clot, whether the clot is in the small vessel or it is in the big vessel. If there is a clot sitting over there, then we can see whether the patient is amenable for IV thrombolysis or mechanical thrombectomy. So, this is how a protocol has to be there in a hospital, and this protocol has to be strictly followed for managing the patient in acute ischemic stroke.
Okay, doctor. So, doctor, in acute ischemic stroke, what are the emergency treatments available for patients?
Yeah. So, in acute ischemic stroke, the patient is visiting the hospital within the golden period. The patient has to be evaluated, and the imaging is done. There is no bleed. Then we have to take him up for giving an IV thrombolysis, which can be given in 4.5 to 6 hours. That is the golden window. If the patient has crossed the golden window, there is an option called as mechanical thrombectomy, where we will take small tube inside the brain and we will open a stent and we will pull the clot outside. It is like vacuuming the blood vessel, or snaring the fishnetting the blood clot. Once the blood clot comes out, the blood vessel opens up and the normal blood flow will happen. So we will save the brain tissue which is at risk. Though that is why it is very important to identify the symptoms of the stroke and to bring the patient as early as possible to the hospital, that is a stroke ready hospital, and the emergency measures has to be taken to safeguard the remaining brain parenchyma. That is the sole and only reason in treating acute stroke.
Okay, doctor. So, doctor, you mentioned stroke ready hospitals. So, most of the time people doesn't know where to go and when to go. So, when to go you have already said. And stroke ready hospitals, how do people should identify those centers? Like, this hospital is stroke ready, and if any kind of emergencies I can take a stroke patient there. So, they have to find out and they have to know beforehand. So, how do they identify, doctor?
Sure. So, the stroke ready hospital, most of the hospitals in Bangalore, that is a multi-speciality hospitals or stroke ready hospital. To be in particular, I will tell you few hospitals like what has to be there in that hospital. In a stroke ready hospital, there should be 24/7 emergency services should be there. A neurologist should be available, a neurointerventionist should be available 24/7, and CT and MR facilities should be there 24/7, and they have to work round the clock, and they should have a protocol how to manage a acute stroke case. These are the stroke ready hospitals. To my knowledge, and for the people, most of the hospitals in our Bangalore are stroke ready hospitals. Particularly you can say Nimans, St. John's and all other corporate hospital. These hospitals are stroke ready hospitals where all the services are available 24/7, and there are clear cut pathways for acute stroke patients. These are called as stroke ready hospitals.
Doctor, in any such conditions, like whatever the condition it might be, there are myths around it. So I want you to bust some myths about stroke.
Sure.
I'll be asking you some. So can you please answer me?
Definitely.
Yes, doctor. First one is only old people get stroke.
That is the biggest myth. So the fact about this is we have seen people who are younger, that is even 25 years, 20 years people also developing stroke. As I have told you, the risk factors of the stroke, the patients having maximum stress, patients are obese, they are sedentary lifestyle, more alcoholism, more smoking. These are the risk factors for the stroke. The old people alone getting stroke is a myth, and it can be happening in young people also. It all depends upon the lifestyle.
Okay, doctor. So the next one is if symptoms resolve, it's not so serious. So is it a myth or fact?
The symptoms resolve. There are two types of ischemic strokes. One is small stroke and a major stroke. These small strokes happens whenever there is a small emboli stopping a small blood vessel. But in a major vessel where major brain territory is involved, these patients will have a major stroke and they will have a permanent disability if we are not treating the patient at the earliest. If we treat the patient earliest, the patient will get recovery at the earliest depending upon the brain tissue involved. So the myth around this thing is when the disability is permanent and it is involving a major brain tissue, the recovery period is extremely long and they will be dependent, permanently dependent. But if we treat the patient at the earliest and the damage to the brain tissue is less, the chances of recovery is extremely high and they will become independent.
Okay, doctor. The next one is they say stroke can't be prevented.
Yeah.
So is it myth
No,
or fact?
it is a myth. Stroke can be prevented. It depends upon the lifestyle. Half an hour a day exercise, 10,000 steps a day, no minimal or no alcohol, no smoking, control of the cholesterol, diabetes and hypertension. Stroke is definitely preventable, and the lifestyle modification plays a major role in preventing the stroke.
Yes, doctor. And I think this is important one. Often people say if few hours is passed, there's nothing to do.
Yeah.
So is it myth or fact, doctor?
That is also definitely a myth. Depending upon the patient and the amount of brain tissue involved, time has extended from 4.5 hours to 24 hours also now. So a patient who is a candidate for mechanical thrombectomy and the brain tissue is enough, there is enough brain tissue is there to save, the patient can undergo mechanical thrombectomy and the patient recovers significantly. Only challenge is awareness, and you have to identify the symptoms early, and you should not neglect the symptoms and saying that okay, already time has finished, we can't do anything, you stay in the home only. No, you should bring the patient immediately to the hospital. Let the expert evaluate, let them decide what has to be done next.
Doctor, for every stroke patient, the recovery period is most important one. The rehabilitation stage is also very important. So how exactly does a stroke patient recovers, doctor?
So that's a very important question, and everyone should know the answer for this. The stroke, it's always stroke management, it's always a teamwork. Once the management of the stroke in acute period is done, it is not like a magic. Patient will not wake up and get up the next minute and walk around. The patient will have already a disability. The patient, if he undergoes proper rehabilitation therapy like physiotherapy, exercise and neurological rehabilitation in a proper way, they will show a significant improvement. Brain is a miracle organ. It develops lot of other connections if we do the rehabilitation properly. So rehabilitation plays a major role in this acute stroke management after a patient develops a stroke. So rehabilitation is very important in management of the stroke.
Okay, doctor. Doctor, and how long does it take a stroke patient to recover, doctor?
As per the studies, it says that whenever an acute stroke happens, and it will take a minimum of 90 days for them to recover. If the rehabilitation and properly given within 90 days, the patient recovery will be excellent, and after 90 days the rehabilitation and the recovery is not that great, but within 90 days the rehabilitation is very good, means the patient recovery also will be very good.
Okay. Doctor, in any condition, lifestyle plays a vital role, because if we do some important lifestyle changes, we can reduce risk of many problems. So in terms of stroke, what are the necessary lifestyle changes that are required to prevent it?
Yes. The necessary lifestyle changes in prevention of the stroke is of utmost importance, since the stroke is a preventable disease. What all the things you have to do to prevent the stroke is daily half an hour of physical exercise, at least 10,000 steps, or you should stop using alcohol, smoking and stress. These are the main things we have to modify in your lifestyle. And the other important thing which can be used for controlling the stroke is hypertension. Once the hypertension is controlled, the stroke risk will significantly reduce. And in our present life, where we are running for money or running for work, you should spend some money for some duration for your own health. That is more importance. So to prevent stroke, hypertension is the most important cause to control. At the same time, lifestyle modification, as I have told earlier, it is of the utmost importance to prevent stroke.
Okay. Doctor, and you have seen many patients who struggles because they have experienced stroke, and even their family struggles. So according to you, what is the significance of this World Stroke Day?
World Stroke Day on October 29th is an excellent initiation founded by or started by World Stroke Organization. All this World Stroke Day is celebrated to create awareness. So as I have told you earlier, everyone knows heart attack.
Yes.
How? Because everyone knows in movies or by media how a heart attack patient will manifest, but no one knows what is a brain attack or a stroke.
Stroke, yes.
This World Stroke Day, everyone should know what exactly is a acute ischemic stroke or brain attack. So next time, whenever a patient in your family gets a stroke, they should understand these are the symptoms of stroke similar to an heart attack, and they should not wait, and they should bring the patient immediately to the hospital so that we can act fast and treat fast. So that's why we have told you, be fast in identifying the symptoms of stroke and act fast to treat the stroke. This World Stroke Day, we try to educate the people. We want to bring all the stakeholders in the community, let it be the media, the politicians, the doctors, the healthcare providers, everyone under one roof, so that everyone will understand the importance of the stroke, and they will play accordingly their roles in preventing the stroke and creating awareness among the people in the community about stroke. That is the main agenda for this World Stroke Day.
Yes, doctor. Thank you so much for shedding light on this stroke topic, and thank you so much for discussing things with us today and sharing all the things related to stroke. Thank you so much, doctor.
Thank you. Thank you. Yeah.
So this was it for today. Thank you.